Hi guys, so today I am 5 weeks pregnant. Very excited. My husband's at work right now. Sorry, my dogs are being loud. Stop it, guys. I just got back from the doctors. My husband is at work now. And everything checked out fine. The bleeding scare is nothing to be worried about, is what my OB says. And today my HCG level was 2,713. So my number actually tripled in 48 hours, which I am so thankful for and so grateful. But the appointment went great. He didn't end up doing a second ultrasound, which I was a little bummed about because while we were at the hospital, they said that they were going to do a ultrasound at my appointment today. But since my levels turned out so great, he doesn't seem worried. I'm going to update you guys on a little bit about my history. For those of you out there who have it, maybe this could be kind of a support blog. I have a blood clotting disorder called MTHFR, and what happens is my blood, it clots too easily on its own to where blood, may not be able to pass through the placenta to the baby. So I found out that I had this through my sister. My sister had 4 miscarriages, and they tested her. They did a bunch of blood work on her, and they actually found out that she has it as well. And my father, he is a carrier of factor 12. So he has factor 12. My sister has MTHFR. She is heterozygous, and I actually have it a little bit worse than her. I am homozygous. I have 2 mutated copies of the MTHFR factor, which makes me very nervous because I am considered high risk for a miscarriage. I'm sorry, my dogs are being kind of loud. Guys, stop it. And so I am high risk for a miscarriage, but I'm hopeful, and my levels are great, which my sister, I live a little bit of a healthier lifestyle than her. And since my levels are going great, the doctor doesn't seem concerned, but he is going to put me on the same medication regimen that my sister was on. And so right now, I am currently taking every day, like up to this day, I've been taking 81 milligrams of aspirin every day. Excuse me, I just ate. The Nevo prenatal vitamin, which is great with MTHFR, and also 800 micrograms more of folic acid every day. And today he is actually going to start me on a couple more things. He wrote me the prescription for, I am now going to take vaginal progesterone every day, twice a day. And then I actually got to go pick that up later this evening. And then I am to schedule an appointment right away with my hematologist. Lily, come here. I'm supposed to schedule an appointment right away with my hematologist so they can get me started on Lovenox injections. If you're not familiar with Lovenox, it's an anticoagulant. It helps to thin the blood. Lily, come here. And so I'm hoping that my hematologist stays, and does everything that my OB is saying that he is going to do. Sorry, this video is going to probably be a long one. So I need to call here in a little while and make an appointment with him so we can get started on my Lovenox injections. Dr. Moodley, my OB, wants me to stay on those until about after my first trimester, he said, and then we may, back off on some of the stuff because I'm more in the clear after my first trimester is over. But like I said, today I am measuring exactly 5 weeks. He said everything looks good. The only thing that came out a little bit bad today was it looks like I have a little bit of a yeast infection, which I can handle that. He said my cervix looked friable, and I just asked him what that meant, and he said it just looked a little irritated, and that's when he said you probably have a little bit of a yeast infection. So I'm not concerned. He said everything is looking great, and he said I'm having a normal, healthy pregnancy right now, but he is going to, stay ahead of the game and be preventative with the progesterone and the Lovenox. I'm nervous about giving myself shots every day, I'm not going to lie. But I give them to patients every day, so it's not going to be bad. I know how to do it. For symptoms, I guess I'll do like an update of my full week 4. Symptoms, I've been very gassy and burpy. My husband thinks it's completely gross, and he just makes me mad because he stinks way more than me. I still have some tenderness in my breast. That's not as bad. Maybe I'm just getting used to it. I don't know. I pee so frequently. Trying to think. I've had some little bouts of nausea, but not much. I have not gotten sick. So right now I'm having it pretty easy, and I'm going pretty good. The only scare was, if you want to look back at the other video, I had a bleeding scare a few days back. But he said that everything, checked out fine, so we are good. So it is normal to bleed, ladies. So don't worry. Just, check in with your doctor. If it's past hours, go to the ER, get checked out. So we are happy and healthy and pregnant. So no more symptoms other than that. I will keep you updated on my hematology appointment. Hopefully they can fit me in. I have today and tomorrow off, so I'm really hoping that they can fit me in for an appointment so we can get started on all of my medications. But other than that, I think we will update you in 1 week with week 6. I am going to remember this time and put a belly shot in this video. So let me apologize. You like my little headband? I made this one. Go to Hobby Lobby. Makes it really cheap. Let me prop up my camera real fast. Sorry. Gotta get this situated. Alright. Let me hold on my pants so I don't look huge. And I just ate, so I'm kind of bloated. Oh, I'm sorry. Milo, get down. I apologize. But like I said, I just ate, so I am a little bloated. Down some more. There. I have been a lot more bloated in this region. I can feel myself poking out there a little bit more, especially right here. I'm more bloated and sticking out. Whew, I am poking out, that's for sure, more than I was. So, there you go, ladies. And I will keep you guys updated. So, week 6, here we come.